Good morning. My name is Ian and this is Brian here. I'm going to be Brian's physical therapist today. As you can see, he's warming up on the cycle ergometer right now. Today we're performing an Astrand submaximal exercise test to determine his aerobic capacity. So right now he's pedaling at a rate of about 50 RPMs at a low workload of 25 watts for 2 to 3 minutes, just as a warm-up, so he gets his muscles nice and ready to perform the exercise test. Before the exercise test, I measured his resting vital signs. His blood pressure was 116/72, and his heart rate was 62 beats per minute with an RPE, which is a rating of perceived exertion, of 6. And so the calculations, his submax heart rate range based on his age is 115 to 163 beats per minute. So that's 60 to 85% of his heart rate max, which is 192. Alright, well, looks like the warm-up is about complete. Based on Brian's fitness level and the ACSM recommendations, I'll now increase the workload to 100 watts. And the whole time he's going to try and maintain that 50 RPMs. I know it's a little difficult, but he's doing a great job right now. And Brian, if you feel tired or faint at any point through this exercise test, just let me know, okay? Sound good?
Will do.
Alright. And so before the test, the bike seat was set up at the height of his greater stroke canter, and there's a slight 5 to 10 degree bend in his knees when he's extending, so bike looks good. And additionally, before the exercise test, I determined that Brian will have no issue throughout the test. He's physically fit and he doesn't have any cardiovascular risk factors. He performs aerobic exercise and lifting weights several times a week. So, as I said before, I don't want you to push yourself too hard, so if you feel tired or faint, just let me know, okay?
Okay.
Sound good?
Yes.
Okay. How's that feeling?
It's pretty difficult.
Okay, good.
That's okay.
Alright, looks like it's been about 2 minutes, so I'm going to assess your heart rate and blood pressure and RPE, okay? So I'll take your arm here, and just keep pedaling at that same intensity. Okay, very good. I'll take your blood pressure, rest your arm up here. Okay, thank you. Go ahead and put your arm down. Okay, Brian, according to this scale here, how are you feeling? What's your exertion level? 12? Okay. Okay, well, your heart rate was about 136 beats per minute, which is within your target submax range, and your blood pressure was 126/72, which is definitely a normal response to exercise. Systolic went up a little bit, but diastolic remained about the same. So I'll measure your vitals again in about 2 more minutes, and then your heart rate again after that. So what I'm looking for tells me that this test is over, is a steady state heart rate. So that means a heart rate within 5 beats per minute of each other at minutes 5 and 6, okay?
Yes.
And then from there we can assess your aerobic capacity. So Brian, have you ever done one of these exercise tests before?
No.
No?
I have not.
First time.
First time.
What do you think so far?
Well, it's kind of difficult.
Yeah.
Yeah. My legs.
Yeah, feeling the
Yeah,
legs.
I'm not tired here, but my legs, yeah.
Quads are burning.
Quads are burning. It was a mistake working legs yesterday. You give these tests often?
Yeah, I do for my patients from time to time when they're interested in their aerobic capacity or if they want to, increase their aerobic work level.
That's
Pretty common test.
very cool. Very cool.
All right. Well, let's go ahead and measure those vitals again, okay?
Okay. Sounds great.
Let me take your heart rate here.
Yes.
Keep breathing. You got it. Okay, very good. Then rest your arm up here. Take your blood pressure. Okay, put your arm back.
Yes.
And Brian, what is your perceived exertion rating
17.
here? 17, okay. So getting pretty hard.
Yeah, it's getting pretty hard.
Okay.
Getting pretty hard.
Well, your heart rate is now about 140 beats per minute,
Yes.
which is again in that submax range. Go ahead and keep going one more minute and I'll take that heart rate again, okay?
Yes, sir. Oh, jeez.
Doing well?
Yeah.
Okay,
Oh, it's fun. It's a great day in Colorado.
excellent. Excellent. And just so you're aware, your blood pressure, that last reading was 130/72.
Oh, okay. So it went up a little bit, which is normal, right, doctor?
Yep, very normal.
Goodness.
You're doing well. Keep it up. Okay, let's do that heart rate one last time. Hopefully we're in that range. Keep pedaling.
Yeah, I am. Yes. Yes, sir.
Okay, good. And RPE one last time.
That's like 18, 17, yeah.
Gotcha. Okay. Well, great news, Brian. Your heart rate that time was 142, which is only 2 beats off from your last reading. So that's in that specified range, so we can go ahead and begin cool down. I'll decrease the resistance back down to 25.
Yes.
All right. So then after the cool down, I would assess his blood pressure, heart rate, and RPE one more time, and that'll conclude the exercise test. Do you have any questions for me, Brian?
I think you did awesome.
right.
Amazing. Great.
Thank you.